Hi, my name is Jennifer. I'm 31 years old and I went gummy with Natrelle INSPIRA Cohesive. I teach yoga just because it makes me happy. My full-time job is I'm a sales director for a tour company. It keeps me pretty busy. The first time I decided to get a breast augmentation, I was pretty young, but I didn't ask a lot of questions and I didn't feel, after the fact, super informed. Looking back on it anyways. So I wasn't super happy with the way that they turned out. I felt like I was covering more than I wanted to for having made this big decision, and yeah, just kind of disappointed. They weren't as soft as I was hoping they were going to be. I had silicone the first time, and I was pretty small to start with, and so there wasn't a lot of tissue over that. And these are all just things that it would have been nice to know when I was choosing implants, when I was choosing sizes, all that kind of stuff. So that was kind of the first round. I knew it was time to get a revision and to seek out another surgeon because the difference in how they were sitting was starting to become more noticeable. I felt like my posture was kind of being affected, but I was just ready. I was ready to start over. My revision consultation was like night and day compared to the first one. Just the amount of information and clarity that I felt like I had, that I was given, the options that were presented, and then explaining just how the procedure was going to work was just really clear the second time. My surgeon encouraged me to pick up the different implants, to feel the different materials, to really kind of just get a feel for what it was that was going to, that was going to make my decision clear for me. When I picked up the Natrelle INSPIRA Cohesive, I could feel the gumminess, the density, that it held its shape. It reminded me of, I don't know, the squishiness of it was just very appealing, I guess you would say. It was hands down the choice that I was going to make. That was kind of the first step. And then, again, because I was smaller to start with, knowing that that was going to be the look and feel that was going to be closest to what I wanted. There really wasn't a whole lot of other deciding factors. It was pretty automatic. My surgeon actually told me a lot about sizing and CCs. One thing that was really different this time around than my first consultation was he encouraged me not to worry about how many CCs. That was something I remember kind of, I don't know what you want to call it, obsessing about the first time. But depending on the profile and depending on the shape and your body frame, that's not really what's going to matter. So we spent a lot of time looking at pictures. He had me bring it, I must have showed him like 10 or 15 different pictures, and he explained the difference between different body shapes, and what mine was going to do with that look and how close they were going to get to what I liked, and just basically to trust him. I think he took 5 different sizers in to my surgery to make sure that what I came out with was as close to what I had pictured in my head before I went in. There was not really any surprises about the breast revision experience, but like I said, my surgeon was really on top of just explaining everything to me. He made me repeat back, actually, some of the things that he told me. So yeah, no, I wasn't surprised. Maybe my biggest surprise was how well I listened, because sometimes I don't follow directions very well. So I was proud of myself for that. My surgeon was very big on aftercare. He talked to me about the importance of the follow-up consultations, following his directions to the letter, and he made sure that I did that. Just because even after you feel better, your body's still healing. So taking good care of yourself is how you are going to last longer, I guess. I would tell women looking for a revision, do your research on your surgeon, find somebody that you're really comfortable with. So finding somebody who really takes pride in what they do, who cares enough to explain to you, and really, at the end of the day, it's whoever you're going to be most comfortable with. Finding out about the Natrelle Gel Rewards program was a bonus. I had picked the implants already, and then my surgeon and his nurse just basically told me that you got a free gift that came with it, and it was icing on the cake, I guess. When I found out about the rewards program, I opted for the Botox. Having a breast revision didn't affect me negatively to exercise or do yoga, which was great for me because I do teach yoga. So having the surgery didn't inhibit anything that I have to do in my daily routine as far as gym, exercise, workout, or yoga, and that was a real positive for me.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.
Approved uses. Botox Cosmetic is a prescription medicine that is injected into muscles and used to temporarily improve the look of moderate to severe forehead lines, crow's feet lines, and frown lines between the eyebrows in adults. Important safety information. Botox Cosmetic may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and overall muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, and trouble swallowing. Botox Cosmetic dosing units are not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when Botox Cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, and/or forehead lines. Botox Cosmetic may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox Cosmetic. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you are wheezing or have asthma symptoms or if you become dizzy or faint. Do not receive Botox Cosmetic if you are allergic to any of the ingredients in Botox Cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myobloc, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A. Have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox Cosmetic. Tell your doctor about all your medical conditions, including plans to have surgery, had surgery on your face, have trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox Cosmetic can harm your unborn baby, are breastfeeding or plan to. It is not known if Botox Cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Using Botox Cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox Cosmetic in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myobloc, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection. Take muscle relaxants. Take an allergy or cold medicine. Take a sleep medicine. Take aspirin-like products or blood thinners. Other side effects of Botox Cosmetic include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids and eyebrows, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-678-1605. Please see Botox Cosmetic full product information, including boxed warning and medication guide.